How do annual income thresholds affect VA healthcare eligibility? Imagine navigating a complex system where your financial situation determines your access to essential health services. That is precisely what Veterans Affairs healthcare eligibility involves, especially when considering annual income thresholds. These thresholds serve as a key factor in determining whether a veteran qualifies for certain healthcare benefits through the Department of Veterans Affairs. The VA uses income thresholds to establish eligibility for various healthcare programs, including the priority group system. These thresholds are set annually and are based on the federal poverty level, which varies depending on household size and location. For example, if a veteran's annual income falls below a specific percentage of the federal poverty level, they may qualify for the highest priority group, which offers comprehensive coverage with minimal or no copayments. Conversely, veterans with higher incomes might fall into lower priority groups, which could mean increased out-of-pocket costs or limited access to certain services. To determine eligibility, the VA considers gross household income, which includes all income sources such as wages, retirement benefits, rental income, and other earnings. It also factors in household size because larger households typically have higher income thresholds to qualify. Veterans are required to submit documentation such as tax returns, pay stubs, or benefit statements to verify income levels during the application process. Changes in income thresholds can influence a veteran's eligibility over time. If a veteran's income increases beyond the set threshold, they might lose eligibility for certain programs or face higher co-payments. Conversely, a decrease in income can make a veteran eligible for more comprehensive benefits. The VA periodically updates these thresholds to reflected economic changes and ensure that assistance reaches those most in need. In summary, annual income thresholds are a dynamic component of VA healthcare eligibility. They help ensure that limited resources are directed toward veterans with the greatest financial need, shaping the scope of benefits and access to care. Understanding these thresholds can empower veterans to navigate the system more effectively and access the healthcare services they deserve.